Morning, good afternoon, good evening everyone. Today we are going to discuss another topic, that is anti-diuretics. In earlier video we have discussed about diuretics, what are diuretics, what is their mechanism of actions, what are their adverse effects, what are their contraindications. Now in this videos we are going to discuss specifically on anti-diuretics. So if you see this, there is a word anti is there. So anti means it inhibits the diuresis. So anti-diuretics are those agents which inhibits the diuresis. So what is diuresis? Diuresis we have already discussed. Diuretics are those agents which will increase the output of urine, or which will increase the output of water and sodium ions from the body. So these are the opposite of it. These are the drugs, these are the agents which will inhibit the diuresis. So particularly in such kind of conditions where you want to retain water in the body, so you have to give antidiuretics. For example, there is a loss of body fluid, so in that case you don't want to remove the waters from the body, so in that case antidiuretics you have to be give. So if we talk about the drugs under antidiuretics, so the drug is synthetic drug desmopressin. So desmopressin is a synthetic analog of, it's a synthetic analog of desmopressin. Sorry, it's a synthetic analog of vasopressin. Vasopressin is your antidiuretic hormones. Vasopressin. So this is the one of the drugs which comes under antidiuretics drugs. This is the desmopressin. It's a synthetic analogs of vasopressin. So what is vasopressin? Vasopressin is your antidiuretic hormones. We also call it ADH, antidiuretic hormone. Antidiuretic hormone. This is ADH. So ADH is your vasopressins, and desmopressin is the one of the drugs which is the synthetic analog of vasopressins, right? So what is its mechanism of actions, how it acts, so that we are going to discuss next. So how these antidiuretics hormones particularly retains our waters, right? So as I said, these vasopressin, so vasopressin is a antidiuretic hormones which is stored in the synthesized, and which is particularly synthesized in hypothalamus. So you know this is a part of brain. So it's this vasopressin is synthesized in the hypothalamus, and it stored in posterior pituitary. So it's synthesized in the hypothalamus and stored in the posterior pituitaries. So inside the vesicles in the posterior pituitary, this hormone is synthesized, right? This hormone is stored inside the vesicles in the posterior pituitary. So vasopressin is antidiuretic hormone which is synthesized in the hypothalamus and stored in the posterior pituitary. So when it released, whenever there is a stimulus, so that stimulus will result in release of these vasopressins and it reach in the systemic circulations. So what are the stimulus? So stimulus can be your, when there is a there is a low waters, decrease in body fluids. For example, patient is suffering from severe diarrhea, vomiting. So there is a loss of fluids and you want to retain the fluids in the body. So these are the some of the stimulus which will release the vasopressin which is stored inside the vesicles in the posterior pituitary. So this, when there is a stimulus, this is going to release, this is for example your blood circulations, it's going to reach in the blood, it will be released when there is a stimulus. These hormones, that is your vasopressins, So it will reach in the systemic circulations, right? So you all know, and many times we have discussed, whenever there is any chemical release and reach in the systemic circulation, it's going to distribute all over the body and it's going to act on its receptors. So receptors for vasopressins are V1, V2 and V3. There are three types of receptors on which vasopressin can act. And I told you, whenever we talk about receptors, so second things which should be comes in your mind is about particularly which type of receptors these are, right? So when we talk about vasopressin, when it reach in the blood circulations, there are three types of receptors on which it can act. The receptors are V1, V2, V3. So many times we have discussed, as I said, second questions which should arise in your mind is which type of receptor these V1, V2, V3 belongs. So I told you there are four types of major types of the receptors. One is your GPCR, there is a ligand gated ion channel receptors, there is a enzyme linked kinase receptors, and there is your nuclear receptors. So these are the four major types of the receptors. So with which receptors these V1, V2, V3 belongs? So answer to this is these all V1, V2, V3 are GPCR. So that means these all are G protein coupled receptors. And when we talk about G protein coupled receptor, many times we have talked, this is a cell membrane receptors. These are receptors which is present on cell membrane. These all are the cell membrane receptor except nuclear. As its name indicates, nuclear receptor is the receptor which is present inside the nucleus. So GPCR are all the cell membrane receptors, right? And when we talk about GPCR, so it's present on the cell membrane, and you all know the configuration of GPCR 1, 2, 3, 4, 5, 6, 7. So that's why, because it crosses the membrane 7 times, so that's why we also called it 7 transmembrane receptors. If you see it carefully, you will find it looks like a snake. So due to that, we also called it serpentine receptors, right? So this is extracellular ligand, extracellular domain. This is your cell membrane. This one is your cell membrane. This is your phosphate molecules, right? Phosphates and your hydrocarbons, right? This is composition of your cell membrane which contains your phosphate and lipid. So outside the cell, the domain which is outside the cells, that we call extracellular domain, and the domain which is inside the cells, that we call intracellular domain. So there are two domains in the GPCR. So whenever this vasopressin release, these all are the GPCR V1, V2, 3. It attached to its ligand binding domain, that is extracellular domain, where your ligand is going to bind. So what is the ligand in this case? Ligand is your vasopressin. So vasopressin is your ligand which is going to bind with extracellular domain and going to do the changes in the intracellular domain. So it carries the signals from outside to inside the cells. So in this case, there can be GS, it can stimulate GS, GQ and GI, right? So all are GPCR, but they can different. Maybe V1 can stimulate GS or GQ, or V3 can do any isoform. So V1 is particularly, second thing which you have to know is location of these receptors. V1 receptor is present on blood vessels. So blood vessels have a V1 receptors. V2 receptor is present on collecting duct, that is your part of nephron. V3 is present on anterior pituitary. So these are the location of these receptors, V1, V2, V3. V1 is present on blood vessels, V2 is present on collecting duct which is part of nephron, V3 is present on anterior pituitary. So V1 and V2 is going to stimulate GQ isoform. So whenever your vasopressin is acting on the blood vessels, there is a V1 receptors, it's going to stimulate GQ isoform. whenever your vasopressin is going to act on anterior pituitary where is a V3 receptors, it's going to stimulate GQ. Whereas when vasopressin is acting on the collecting duct which contains the V2 receptors, again it's GPCR, but it's going to stimulate GS form, GS rather than GQ. So you all knows when GQ is stimulated, so what will happen? Your phospholipase enzyme is going to activate. Phospholipases. These phospholipases will do the degradations of phospholipids, which is major component of cell membrane, and do the breakdown into two components, that is IP3 and DAG, these two molecules. IP3 is your inositol triphosphate, inositol triphosphate, and DAG is your diacyl glycerol, that is your DAG. DAG is further going to activate protein kinases, right? And IP3 has a receptors on smooth endoplasmic reticulum, which is the storehouse of calcium ions. So more calcium will release. So increased level of calcium inside the cells is going to results in the contractions of the blood vessels, right? So ultimate effect, these protein kinases are also going to constrict your blood vessels, constrict blood vessels, constrictions. And if you see the name carefully, there is a vaso and another word is pressin. So it's going to press the blood vessels. So vasopressin is going to constrict your blood vessels. And if question is asked, what is the mechanism of vasopressin induced vasoconstrictions of the blood vessels? The answer to this question is V1, it's act on the extracellular domain, it's going to activate GQ form. GQ is going to activate phospholipases, which will do the degradation of phospholipid into IP3 and DAG, that are diacyl glycerol and inositol triphosphate. Inositol triphosphate have a receptors on smooth endoplasmic reticulum, and smooth endoplasmic reticulum is the storehouse of your calcium ions, and these more calcium will release and result in constrictions of blood vessels, right? So that is your answer to this question is, just one second, hello, आप निकल जाओ सर, हाँ लैब खुली रखना, ओके. So sorry. So particularly, as I said, if question is asked, now I hope you got in concept in your mind vasopressin. When we talk about vasopressin, what is vasopressin? Vasopressin is a anti-diuretic hormone, and we have a drugs which is analog of vasopressin, and drug name is desmopressin. Desmopressins. So it's an anti-diuretic drugs, right? So what is the mechanism of actions? So when I told you vasopressin is synthesized in the hypothalamus, it's stored in the your posterior pituitary, and whenever there is a stimulus, whenever there is a decrease decrease volume, body volumes, so decrease waters, so that are the stimulus to release that vasopressin which is stored in the posterior pituitary. So it's going to release, and after release, where it comes to the systemic circulations, in the blood circulations. So through the blood circulations, it going to distributed all over the body. So it has a receptors. So it has a receptors V1, V2, V3. These are the receptor of vasopressin. And as I said, all these receptors are GPCR, right? Their configuration is same. So now one by one we are talking about V1 receptors. V1 receptor is present where? It's present on blood vessels, right? So on blood vessels, when it acts, what is configuration of GPCR? 1, 2, 3, 4, 5, 6, 7, right? 2, 3, 4, 5, 6, 7. That's why we call it 7 transmembrane receptor, already told. So this vasopressin is going to attach here in the extracellular domain, and it's going to activate GQ form, and GQ form is going to do DAG and IP3 formations. IP3 has a receptors on smooth endoplasmic reticulums which release more calcium ion. More calcium ions will do the contractions of blood vessels. So ultimate effect is vasoconstrictions. Vasoconstrictions. And that's why, if you know, we have talked about the shock, hypovolemic shock. So in hypovolemic shock, we also giving the vasopressor agents. We want to increase the blood pressures. We want to maintain the blood pressures of the patients. If there is a hypovolemic shock, that means blood volume has been decreased significantly, right? So it going to do the vasoconstrictions, and by this mechanism, it's going to result in the vasoconstrictions or constrictions of your blood vessels. That is a mechanism. Another is V2 receptors. V2 receptor is present on collecting duct. Collecting ducts, and collecting ducts are the part of your nephron, right? So nephron we have discussed in details in diuretics videos. What are nephrons? There are a proximal convoluted tubules, there is a descending loop of Henle's, ascending loop of Henle's, then there is a distal convoluted tubules, and then there is a collecting ducts. So last part is your collecting ducts. So collecting ducts is normally impermeable to water molecules. When these receptors are stimulated in the collecting ducts, so it's going to do the transport of water channels on the luminal sides, and due to these water channels your water is going to reabsorb, right? So what is the mechanisms? I am going to explain. When vasopressins act on V2 receptors, and V2 receptor is which? It's a GPCR. Again, it's a GPCR. But these are present on, for example, this is your luminal side. This is your vasolateral membrane, right? And then there is a blood circulation, systemic circulations, right? So now here water molecules comes, water, right? So in the presence of vasopressins, what will happen? Vasopressin has a receptors on these collecting ducts. This is your collecting duct. This is last part of your nephron. So this vasopressin is going to act, and again it's a GPCR. So it's a 7 transmembrane receptors, 1, 2, 3, 4, 5, 6, 7. So it's going to bind here, and this receptor is V2 receptors. Where it present? It present on the collecting ducts. And what is collecting duct? Collecting duct is a part of nephron. So now it's going to activate your GS form, GS, stimulatory. So when GS form is stimulated, so you all know there is going to activations of one enzyme. That enzyme name is adenyl cyclase. Adenyl cyclase enzymes, what it do? It do the degradations of ATP into CAMP. So there is an increase in CMP levels. So this increased CMP will do the phosphorylations and do the transport of channels here at the numeral side, and these channels are your water channels. These are the channels, water channels, or you call it porine channel, aquaporine, right? So through these channels, this water will be reabsorbed back. This water will be reabsorbed. And what is the mechanism of, means what is its role? It's an antidiuretic. Antidiuretics means it will inhibit the release of water molecules. It will decrease the urine, right? Antidiuretic. So how it's, again I am explaining. It act on V2 receptor. V2 receptor is GPCR. GPCR have a 7 transmembrane. It will bind with the extracellular domains. It's going to activate intracellular domain GS form. GS form, when it's stimulated, it's going to activate one enzyme. That enzyme is adenyl cyclase. Adenyl cyclase will do the degradation of ATP. There is an increased level of CMP. Increased level of CMP will locate the water channels on the luminal side, and these water channels will help to reabsorb the water molecules. and produce the antidiuretic effects, right? I hope it's clear. Normally it's impermeable, collecting duct is impermeable to water molecule, but under the presence of vasopressins, which is a release when there is a stimulus, when body want to retain the water. So in that cases vasopressin is released from your posterior pituitary, it reaches to the systemic circulations. Through the systemic circulations it will act on the collecting ducts, and in collecting ducts the receptor is V2 receptors, and it's going to transport water channels on the luminal side, and due to that your water is going to reabsorb back. So that is your mechanism, antidiuretic mechanism of your drugs like desmopressin as well. That is a synthetic analog of vasopressin. Then now third receptor is your V3 receptor, and V3 receptor is present on your anterior pituitary glands. So it's going to stimulate release of ACTH, adrenocorticotropic hormones. Adrenocorticotropin hormones is going to stimulate adrenal cortex, and adrenal cortex will release the cortisols, which is cortisol has various role. It will anti-stress, stress management. It will increase the blood glucose level as well. So this is V3 receptors which are present on the anterior pituitary. When your vasopressin act on this receptor, again this receptor is GPCR, but mechanism is same. This is going to activate GQ isoform, GQ only, which you have to change the location. Location is anterior pituitary. GQ, when GQ is activated, your phospholipase is activated, which will do the degradations of phospholipid, PIP2, phosphoinositol, diphosphates, and do the formations of IP3 and DAG. There is more calcium by the IP3. DAG is going to activate protein kinases, and ultimately it will result the contractions, right, and going to stimulate your adrenocorticotropic hormones. Adrenocorticotropic hormone is going to stimulate adrenal cortex. Adrenal cortex is going to release your cortisols. So this is your mechanisms of your antidiuretics, right. So what is, again quickly I can tell you the mechanism. Vasopressin, so it will act, receptors of vasopressins are V1, V2, V3, right, all are GPCR, but again this V1 is going to GQ, going to stimulate GQ, V2 is going to stimulate GS, and it going to stimulate GQ, right. GQ is going to do the formations of two molecule IP3 and DAG, and these will increase calciums, these will activate protein kinases, and ultimately it will do the constrictions. So constriction of what? V2 receptor is mainly present on blood vessels. So blood vessel is going to constrict. So that result in vasoconstriction effects, right. Quickly I am telling. V2 receptors is present on your collecting duct, which is part of nephron. So it's going to stimulate GS stimulations is going to do the stimulations of one enzyme, that is the adenyl cyclase. Adenyl cyclase is going to do the degradation of ATP into CAMP. So increased CAMP levels will do the phosphorylations of water channels, and it will import the water channels on the luminal side of the collecting ducts, and in the luminal side of collecting duct, when there is a water channel, it is going to reabsorb the water under the influence of vasopressin. Otherwise in normal conditions collecting duct is impermeable to water. Then when we talk about GQ, which is present on your anterior pituitary, again it is going to phospholipases, again same mechanism, IP3 DAG, right, and it going to stimulate ACTH, adrenocorticotropic hormones. It's going to stimulate adrenal cortex, and it's going to release your cortisols. So this is all summary about your antidiuretics or vasopressins, right. So thank you. This is all about antidiuretics. In next videos we will discuss about we are going to start another unit, that is the endocrine pharmacology. Thank you. हो गया.